Many runners experience some form of running-related injury within their lifetime, which is generally caused by the high load associated with ground reaction and impact forces through the lower limbs when running. Many factors affect this, including but not limited to running pattern or technique, age, sex, BMI, weight, biological makeup of the athlete, or the ability of the surrounding tissue to tolerate the load. Previous injuries that have been sustained and strength also play a part in this. One of these running-related injuries is patellofemoral joint stress. This is a multifactorial condition of runners leading to pain within the subchondral tissues surrounding the patellofemoral joint. I'm Grice from Charles Darwin University, and this poster presentation is on the biomechanical analysis of running, how foot strike affects patellofemoral joint stress. The primary causes of patellofemoral joint stress in runners are patellofemoral reaction forces and contact areas, which may be affected by the quadriceps force, stifle angle or rotation, coxofemoral rotation, or foot pronation. However, patellofemoral joint stress can be managed by altering step length, step rate, foot strike pattern, or adopting the pose method of running. All of these aim to reduce stifle load and patellofemoral pain. Purpose and method. The overall purpose of this research task was to gather an understanding of the variations in foot strike pattern and running technique which aim to reduce patellofemoral joint stress. Various articles were gathered from places like Google Scholar, PubMed, and the Charles Darwin University Library to undertake this research task. Various searches were used to find appropriate and relevant articles using keywords such as patellofemoral joint stress or pain, running-related injuries, running biomechanics, and the pose running method. Of these searches that were conducted, 3 main articles were included within the results, with a further 9 included as background information and cross-checking research. There are 3 types of foot strike patterns, which can be seen over here in figure 1. You have the forefoot foot strike pattern, the midfoot, and the rear foot strike pattern, with the fore and the midfoot being the most optimal for reducing the risk of running-related injuries, particularly patellofemoral joint stress. When the runner adopts a midfoot strike pattern, the distal metatarsals, which are around this part of the foot here, meets the ground first, with the heel following. During a forefoot strike pattern, however, the foot is in a plantar flex position, so toes are pointing to the ground, and the heel does not meet the ground. The least optimal foot strike pattern is when the rear of the foot, the heel, strikes the ground first, which is seen in this first picture here. The toes follow to produce force, which then moves the body forward. This foot strike pattern is least optimal due to greater force being placed through the various joints of the lower limb and being the least economical for the runner. Generally, this foot strike pattern has become more adopted by runners recently or in recent years due to the cushioning that is now available in most types of running shoes. You see things like Hoka's and Nike's and Asics, which have a really thick sole on them. They've got a lot of foam and a lot of cushioning, and it makes it easy for the runner to naturally adopt this rear foot strike pattern just because they're not feeling pain through their heel as they may have with some older style runners. Figure 2 up here outlines the average patellofemoral joint stress across participants during the stance phase of running. This study was conducted by Vanata et al. 2019. These authors investigated the differences in patellofemoral joint stress in runners depending on their foot strike patterns, so coming back to the rear, mid, or forefoot strike patterns. 16 healthy female runners with an average age of 22 years old took part in the study and completed 20 running trials which utilized the rear foot and the forefoot strike patterns. It was found when the foot strike pattern was altered from a rear foot to a forefoot strike, peak patellofemoral joint stress and peak quadriceps force both decreased by 27%, which can be seen just here. However, when the forefoot strike pattern was implemented, there was an increase in peak vertical ground reaction forces. Figure 3 over here outlines the results from a study by Brahm 2019, which aimed to research if a 10% increase in running step rate, so the cadence of runners, influenced them positively or negatively with patellofemoral joint stress and pain. 12 runners were included within this study over a period of 12 weeks. So they started at baseline, they had a 4-week follow-up, and then finally a 3-month follow-up. Key findings were that once the gait was retrained and step rate was increased by 10%, there was an overall improvement in running kinematics. So we saw that here it decreased, and over here increased in the functionality of the runners. So what these runners saw was an overall improvement within their running kinematics. The athletes had a greater weekly run volume and were able to run longer with no pain. This was maintained over a 12-week follow-up. So over here we see their pain decreasing over the 3 months, and over here we saw them have more functionality within their limbs, and specifically their lower limbs and patellofemoral joint, where they had more functionality at 3 months than what they did at baseline. There's lots of current evidence which suggests that running kinematics improve. The runner adopts more of a forefoot strike. Achilles tendon and ankle joint loading increase, which helps to reduce the risk of lower limb injuries. A rear foot strike pattern generates greater force by the quadriceps muscle, which leads to greater compressive forces at the patellofemoral joint, resulting in patellofemoral joint stress. Contrastingly, when greater force is placed through the Achilles tendon and the soleus, the quadriceps produce less force, which reduces the incidence of patellofemoral joint pain. Additionally, when a forefoot strike pattern has been adopted, the center of pressure moves more anteriorly on the foot and increases the load through the Achilles tendon by 11%. When the Achilles tendon and tissue surrounding the ankle joint are stronger, better shock absorption is provided to the rest of the lower limbs and ultimately the rest of the body. So starting at the knee, leading up through the hips, and then all the way up through your shoulders. Additionally, there's less chance of overpronation at the ankle, which has been shown to contribute to patellofemoral joint stress. Moreover, as the soleus becomes stronger, so a muscle within your calf group, the knee joint is more stabilized and forces produced are then reduced. Likewise, Arison et al. 2004 investigated if the pose running method reduced eccentric load of the knee and therefore reduced patellofemoral joint stress. So we can see the pose running method down here in figure 4. We got the heel, the midfoot, and then the pose running method. The pose running method is similar to the forefoot and rear foot strike patterns as we observed over here. However, runners are attempting to align their body more. So they try to align the acromion, the greater trochanter, and the lateral malleolus, lean forward and allow gravity to create momentum. So we can see that in this athlete here, they essentially have a straight line from their head all the way down through to their foot. So they lean forward, allow gravity to create momentum, they lift their supporting foot and avoid pushing off the surface with their rear foot. And then finally, they avoid striking the ground with their heel. When the pose running technique was introduced to participants, they naturally adopted a shorter running gait, faster cadence, less eccentric work at the knee, and more was produced at the ankle when compared with the midfoot and rear foot stroke patterns. These findings are as that of the previous 2 studies that we have just discussed, confirming that adopting any method to produce a forefoot strike pattern can and will decrease the likelihood of running-related injuries and therefore patellofemoral joint stress and pain. So to conclude, patellofemoral joint stress is a common overuse injury seen within runners and is amongst one of the highest percentages amongst runners. It's more common in runners with a rear foot strike pattern. When the foot strike is altered from rear foot to forefoot or midfoot, there is a clinical reduction in patellofemoral joint stress reported amongst runners. Patellofemoral joint kinetics and kinematics can be altered by training a rear foot strike pattern out of the person's running style. This then allows the athlete to be more of an economical runner and will ultimately save them in the future of having patellofemoral joint stress and pain. However, this should be implemented gradually, as we saw in figure 3. It was implemented over a 4 to 12 week period. Changing a runner's foot strike can aid in the reduction of patellofemoral joint stress and may provide the athlete with long-term benefits.